This video will demonstrate how to manage an airway obstruction. The first section is going to demonstrate how to manage an athlete who is supine and not wearing any equipment. Grabbing C-spine. Assessing responsiveness. Hey, wake up, wake up. No response. Hey, you go call EMS. I have an unconscious adult. Do you understand? Please come back. Head tilt, chin lift. Look, listen, and feel for breathing for 10 seconds. I don't feel any breathing. Get my pocket mask ready, and I'm going to administer rescue breaths to see if the chest rises. My rescue breaths do not go in. Readjusting the airway and trying the rescue breaths again. My breaths did not go in. So I'm going to landmark for chest compressions in the center of the chest. 30 chest compressions, 2 inches deep, 100 per minute, or 30 compressions in 18 seconds. Checking the mouth to see if the object was expelled. I don't see anything. So I'm going to try 2 more rescue breaths. These breaths did not go in. Do another set of chest compressions. Checking the mouth. This time there's an object. Pull it out. And try my rescue breaths. This time, the chest rises and falls. Airway is free. Maintain the airway with an oropharyngeal airway, measured from the earlobe to the corner of the mouth, inserted inverted, and then rotating 180 degrees. And then checking circulation for 10 seconds. In this patient, circulation is present, and breathing is present as well. In this next scenario, the victim is prone but not wearing any equipment. Grabbing C-spine, assessing responsiveness. Hey, wake up, wake up. No response. Hey, you go call EMS. I have an unconscious adult. Do you understand? Please come back. Look, listening, and feeling for breathing for 10 seconds. The victim is not breathing. I have to automatically roll the person, and since I don't have a helper available, I have to roll myself. Head tilt, chin lift, look, listen, and feel for breathing for 10 seconds. The victim is not breathing, so I'm going to try to put 2 rescue breaths in. Head tilt, chin lift. Trying some rescue breaths. The rescue breaths do not go in. I'm going to reposition. Try the rescue breaths again, and they still don't go in. I'm going to start chest compressions. 30 chest compressions, 2 inches deep, at 100 per minute, in the center of the chest. After the chest compressions, I'm looking at the mouth. I see an object, so I do a finger sweep. I'm going to try 2 rescue breaths to see if they go in. 2 breaths go in, and now I'm checking circulation for 10 seconds and breathing for 10 seconds. Now this last scenario deals with a patient who is prone but also wearing equipment. Grab C-spine right away, approach so you're facing the victim, tap and shout, hey, wake up, wake up. No response. Hey, you go call EMS. I have an unconscious adult. Do you understand? Please come back. Check the mouth. Take out the mouth guard. And then look, listen, and feel for breathing. Since they're not breathing, I'm going to roll them right away. And since I don't have a helper, I'm just going to do my best to try to roll the victim as best I can. Once they're supine, I'm going to check pulse right away to see if I need to access the chest first. They do have a pulse, but they are not breathing. So I do have face mask detachment tools, and I'm going to try to remove the face mask in 30 seconds or less. If for whatever reason I cannot get this done in 30 seconds, I have to try to remove all the equipment. So in this case, I was able to detach the face mask. Pulse was present. The victim was not breathing. So I have to try 2 rescue breaths to find out why they're not breathing. The 2 breaths did not go in. So I'm going to readjust the jaw thrust and try 2 breaths again. And those breaths did not go in either. So in order to do compressions, I have to access the chest. Start with removing the jersey with the long side zippers, undoing the shoulder pad underarm straps and the anterior laces, loosening the shoulder pads enough to get my arms underneath to start compressions. 30 compressions in 18 seconds at 100 per minute at 2 inches deep. Once compressions are done, I'm going to look in the mouth and remove any object with a finger sweep if I see it, followed by rescue breaths to determine if the airway is still obstructed. Rescue breaths still did not go in. Landmark in the center of chest for the chest compressions again. And after 30 chest compressions, looking in the mouth, I see an object, 2-finger sweep, and then attempt to ventilate to see if that was the obstruction. Breaths go in. Maintaining an airway with an OPA, and then checking pulse right away. So here are the key points. First, you have to determine why the victim is not breathing. You can do so by checking the pulse. If they have a pulse, it can't be cardiac arrest. You can also check to see why they're not breathing by trying to ventilate the victim. Now, if your breaths go in, they're probably not breathing because they're in respiratory arrest. However, if your breaths do not go in, there is an obstruction in the airway. Now, depending on what the problem is, you would either have to access the airway first or access the chest first. If the victim is wearing football equipment, always check circulation first, because that will determine whether you need to access the chest or access the airway as the priority. If the person is not breathing and you try to put your ventilations into the patient and they don't go in, just remember to reposition and then try ventilating again. If you've determined that there's an airway obstruction, start with compressions to increase thoracic pressure to push the object out, and then check the mouth to see if the object was actually expelled, and then determine if the airway is still obstructed by trying to ventilate.